Stakeholders in Nigeria's health sector have urged the government on the need to adopt a holistic approach to harnessing the potential benefits of domestic medical tourism in the country, while also considering how international organizations can contribute to this endeavor. The call was contained in a communique following the just concluded All-African Medical and Wellness Expo, which came up recently in Abuja. The event, which brought together professionals from both the health and tourism sectors, focused on the theme Developing Sustainable Domestic Medical Tourism for Nigeria. Minister of State for Health and Social Welfare, Honorable Tunji Alausa, who was represented by his senior technical assistant, Dr. David Atuwo, emphasized the need for collaboration among stakeholders, one he identifies as a holistic approach to improving healthcare services in Nigeria.
In recent years, we have witnessed a concerted effort by the government, private sector, and international partners to invest in healthcare infrastructure, develop the training and retention of healthcare professionals, and strengthen our health systems. The National Health Insurance Agency has been expanded to provide more comprehensive coverage of services, and we continue to explore innovative financing mechanisms to ensure that healthcare is accessible to all Nigerians, regardless of their socioeconomic status. We have also seen tremendous growth in the pharmaceutical and medical technology sectors, with more local production of essential medicines and medical equipment. This not only boosts our self-sufficiency, but also creates employment opportunities and contributes to the overall economic growth of our great nation. Ladies and gentlemen, the theme of this Expo, Developing Sustainable Domestic Medical Tourism for Nigeria, is both timely and significant. Nigeria possesses immense potential as a hub for medical tourism. We have the talent, expertise, and world-class healthcare facilities to attract patients from both within and outside our borders. However, to fully realize this potential, we must focus on sustainability. We must continue to invest in improving the quality of healthcare services in Nigeria. This includes not only advanced medical procedures, but also a holistic patient-centered care. Patient satisfaction, therefore, is key to building a sustainable medical tourism industry.
The greatest obstacle in pursuing this vision is misconception about medical tourism. If you ask any Nigerian about their understanding of medical tourism, they will simply say medical tourism is all about traveling abroad for Medicare. This school of thought has narrowed down medical tourism to outbound medical tourism only, while the real concept of medical tourism encompasses both intrabound, inbound, and outbound medical tourism. When we are talking of intrabound medical tourism, it's also known as domestic medical tourism, and it has to do with traveling from where one is residing within the country in the quest for quality medical treatments. It may be from one local government to another within the country, and it may be from one state to another within the country. When we talk about inbound medical tourism, inbound medical tourism has to do with people coming to your country, from another country to your country, to receive quality medical treatments. And we'll talk about outbound medical tourism, which is the household name in Nigeria, the most popular aspect of medical tourism, which has to do with traveling overseas for Medicare. Many of our local healthcare service providers, they don't want to hear this. including those at the helms of affairs. They don't want to hear this. And it's because of one reason that they don't want to hear. What is that reason? It's because of what we are losing to outbound medical tourism year in, year out.
Dr. Yemi Johnson, who delivered a paper on the journey so far for the Nigerian health sector, emphasized that in the last 15 years, there has been a steady rejuvenation in orthopedic practice, with subspecialization in areas such as invasive cardiology, interventional cardiology, closure of holes in the heart, surgically and non-surgically, open heart surgery, and more.
In every specialty in the US or UK, every specialty, if you count 10 top specialists, 5 will be Nigerians. So we have the people, we have the mental capacity, we have the abilities, just we haven't been able to do it back home for a variety of reasons. Because I remember then when I was in school, people from Saudi Arabia and UAE used to come to Nigeria for healthcare. Then things went bad, and then things went bad. But I'm glad to say things are improving, and I'm here to just give you a brief review of what's going on in Nigeria.
Key discussions also centered around Nigeria's access to quality healthcare services, ethical and legal concerns in medical practice, technological advancement, and artificial intelligence for healthcare service delivery in Nigeria, and how medical tourism will impact on Nigeria's healthcare system.
The doctor is called to serve people. And if he's called to serve people, if you're going to attend to me as a doctor, I need to be confident that you'll look after me and look after me well. And if you're going to look after me well, are there ethics, are there things, are there set standards, things that you must do in order to be able to look after me well? Beyond the code of conduct, beyond the code, the professional code, are there laws? Or did the drafters of our laws, did they just leave medical doctors to continue to be practicing? I had all my children in public hospital because I was determined that that is where I would have my children. But the treatment is something else. You go as early as 5. Those days of antenatal, you go, you take number, and then the nurses are strolling in like around 9. After that, they will take us through, we will dance. Then the doctors will not come until like 12 noon. And sometimes by 2, 3, the doctors will say, I've closed, I'm going, for those who are doctor patients. We do know that our constitution, which is our ground norm, provides that every Nigerian is entitled to his or her rights, to the right of life.
Before now, you can imagine that about 95% of children were dying of tuberculosis. Majority of them were unable to access good health care or have never come in contact with anything like vaccination or any form of drugs or treatment. I happen to work in Federal Medical Center, Bida, and I was sharing my experience. I saw a horrible experience. My first, as an MO or a house officer, you're doing your internship. For the first time, I understood that people that were coming to hospital for emergency were basically poor people. Emergency cases were basically poor. Malnutrition cases is only poor people. So you just discover that poverty and sickness, they work together. And it's select, why you are laughing? It selects a few people. No, see, there are kind of sickness that when you are oriented, you will not have.
So taking the first point, we talk about infrastructure. As we all know, there are some of us may be estimated infrastructure, especially in the rural areas. And this, to some extent, also has limited the availability of health care or the quality of health care that individuals receive. Just the way I made mention, most of the primary health centers in the rural area, there are no doctors.
Artificial intelligence enhances drug diagnosis, drug discovery. It has been used in accelerating discovery and efficacy of safety in potential drugs. And this can also be used to develop affordable and effective medications for Nigerians, whereby we can both benefit for local patients and this also for the pharmaceutical industry.
My topic today is sustainable healthcare and medical tourism development in Africa, and to be precise, in Nigeria. And why have I chosen this particular topic? The first question comes in most of the people's mind. Traditionally, Africa has been exporting patients abroad, and they spend easily over $5 to $7 billion sending patients abroad. And there have been newses and information about the problems in healthcare system of Africa. Now, most of the time when the Africa event happens all about how to send patient to from Africa to other countries. But I'm great to see that my dear friend Usman and some of my international colleagues are supporting this event where Nigeria is trying to change that situation and trying to change a sustainable medical tourism development. Now, what is sustainable medical tourism, first of all? You see, if you keep on sending and draining the patient from the country, the $6 billion money is lost from the Africa. If you know, Africa is already a $35 billion healthcare industry, and there are already $65 billion shortage of healthcare expenses they have. And to be surprising, 79% of medicines in Africa are imported. So when you already have these challenges in your healthcare system, it becomes one more issue when you export the patient. Do I mean that medical tourism should stop completely from Africa? Of course not. Across the globe, Europe, India, Thailand, they do provide quality of care at a reasonable prices. So anyone needing the quality of healthcare, patient would still love to travel there. But I meant to say by sustainable is that in return of those $6 billion, the international organization should participate in the growth of African healthcare system. I have been updated with many great news that Nigeria has been doing great work in healthcare system, and they are putting up great efforts. And in fact, there are certain free zones are coming in the healthcare system. I think so. All these things are wonderful news where in more than 50 to 70% patient could retain in Africa for minor surgical procedures or up to tertiary level care and all. And only if for complex surgical process which is not available in Africa, patient can travel abroad. And only request from my side is to the global community and the policymakers in Africa is that even though when the patient travel abroad, and when the money is spent from Africa to abroad, I think so the policymakers should seek some sort of relationship and exchange benefit from these international destinations.
The event also featured engaging panel discussions bordering on collaboration between healthcare service providers and medical tourism professionals in Nigeria.
And I want to go to the earlier recommendation you made, which is about creating a working group. That is a very good recommendation. They can come up with a framework to help achieve some of the challenges that are already existing with, first of all, a buy-in from government, a buy-in from the healthcare providers, and of course, creating a platform and standardization for travel professionals to take these products, create more products from them, and begin to churn the money. Because I see gold, I see money at the end of the day, in addition to providing the healthcare service, because it's about business, is it? Thank you.
Absolutely, absolutely. Couldn't have agreed more. I can see the passion that you're coming from. And I think that makes a big difference. I think collaboration is the key factor among various elements. Different elements have to come together, collaborate, and take it forward in terms of raising the awareness, create more education, as you rightly said. And then this builds an opportunity instead of just looking at it as this is not available or that's not available or not being negative about the situation. Identifying the opportunities and moving forward is a key factor. And I think this discussion right now is popping into the next aspect about, I think we will come to the last segment of our discussion. I would like to conclude with one particular question to all the panelists that I would like to take your input on, is starting from Dr. Prem, is public private partnership. I'm sure Dr. Afzal gave another set of P's in the beginning in terms of perfection and privacy and pricing and all that. But this is another set of P's that we would like to discuss right now, is PPP, is public private partnership, because that's what is boiling down to everything that we are discussing among all of us right now in the last almost an hour now. Is, what do you think? What's your inputs on the PPP model that is critically required? Your few lines in terms of recommendation that we could offer to Nigeria in terms of developing the medical tourism industry for them. Over to you, Dr. Prem.
Yeah, so uh, needless to say the how important it is to go into PPP model, and in fact we can add one more P, which is people. So public-private partnership with enhance, including people. You need all this when, even for the infrastructure development and to the access to advanced technology which is happening. You need PPP model for even improving the cost effectiveness and quality and flexibility in so many areas which Africa at this moment require, which cannot happen, to be honestly, without PPP model. Why I say cannot happen without PPP model? Because the healthcare is traditionally resource consuming industry, and you need to understand that Africa is spending billions of dollars on healthcare right now. So if I talk with the current status of Africa is $35 billion which they are spending, and even if you add on $60 billion in healthcare in Africa, still they were not be able to reach to the quality which we see abroad. Also, if you talk about the pharmaceutical industry, 79% of medicines are still imported in Africa, right? So to overcome these challenges, I see only option is to go for more partnership models, be it a PPP model, be it more international joint venture models, where more organization needs to pitch in to support Africa, and more activities needs to, and forum like these needs to be created to enhance the value of each stakeholder for PPP model as well.
I read something online, and the woman said, somebody came and said the child wants to have a birthday, and that the child said one of the conditions the child gave is that put weed in the cake. Yes, weed in the cake. That the child, a small child, not up to 12, I think 10 or thereabouts, said, I want weed in the cake. And the woman said, initially she declined, but she said, if she doesn't take this job, another caterer will take the job, another baker will take and put weed. So she took the job, but she did not put weed. So when somebody approaches you with something that is obviously, manifestly wrong, good conscience should tell you, decline. Let them carry that money and go. It's not your money. It's not all money that is good money. You want to answer? Yes, I was going to say so that we have not answered this question.
Sir, if I understood you very well, I think your question talked about intentional conduct, like cases of organ harvesting, which are manifestly intentional, and cases that perhaps there was an organ harvesting, but it was done with the intention of saving the life of the patient.
Okay, let me just say, okay. He's talked about intention. I think my friend there, she's a magistrate, and last 2 months they brought a case like that to her court about organ harvesting. That's the kidney. Your worship, I think so. Okay.
What I want to say is this: where a medical personnel intentionally carries out an act that results into damage or injury to a patient, an act that is deliberate, perhaps perhaps with the intention of profiting from it. That is obviously a criminal matter, and such a medical personnel is liable to criminal prosecution at the High Court. Is liable to criminal prosecution, and upon conviction will be sentenced to either imprisonment, a sentence of imprisonment, life, or even execution. It depends on the magnitude of the offense, but insofar as it is intentional, that renders such a personnel liable to criminal prosecution.
I want to emphasize or add to what my colleague has said. I remember when we talked about, the doctor had good intentions. Please, medical practitioners, the law will not look at your good intentions if no reasonable care was taken. So no matter how good your intentions are towards your patient, it's very important that reasonable care is taken. What is expected of you, somebody in your position, in that position to do? For instance, if another doctor should have come in, would the doctor have done what the doctor did? That is what the law will look at, no matter how good your heart is. So it's very important that we must be professional at all times.
The thing is, Nigeria produces enough doctors yearly, internationally and national. Just like if you go to any general hospital now, the nurses there, 80% of them are above 40, 50 years. The young ones, after the intern finishes, they're doing their intern, they are writing exam to travel out. Just like doctors, in Nigeria, if you check how many they produce yearly and those that comes from other countries, if they stay, in next 10 years, we'll have more than 100,000 doctors. But the thing is, the younger ones, the more they stay, finish their house job, do one or two, they write exam and leave. Then how do you tackle it? How other countries have made some survey find out that incentive is more important than salary, right? Look at Asokoro Hospital, for instance, where I work. How many of them can brag of paying house rent in Asokoro? Most of them, how much is fuel? Calculated 30 days, the consultant. We're not looking at the basic things that makes a doctor a doctor. Coming to her, as I saying, good intention. Let me tell you, most of us, if we do the right thing, some patient you refer, come to emergency, that we don't have neurologists, the patient will cry, please, please. When we do the right thing, the patient might die on the way, according to your writing, if I don't have good intent. I might have the small experience to save the life. Nigerian practical is different from theory and medical law and ethics. This patient might come, I can carry somebody's normal salary or somebody's drugs to save that person's life. It might be a keke driver that cannot purchase ceftriaxone. As a medical doctor, if they admit my father and say they need expensive antibiotic of Resofin, do you know I cannot be able to purchase it for 7 days? Do you know that it's drugs that is meropenem that is more than 25,000 naira per dose, 75,000 naira a day? So if that was needed for this particular patient and it's not done, this person would die. So the problem goes back to what I was saying. The medical healthcare negligence and poor policy. There should be universal healthcare coverage. And I was working towards that. Even if you charge, if MTN is 11 naira per minute, you make it 13 naira per minute, that each code 2 naira enters to the healthcare insurance fund. At least a patient, no matter where you come in, you can access healthcare, even if it's for 48 hours before relatives comes in. So a solution should be looked at, not doctor.
There's this consent form that is signed. So is it a universal consent? Okay, so it covers just anything that comes up? Okay.
See, the thing is this, right? The fact that you've signed a consent form, you've given us the permission that your life is now in our hands. That you, on your own, you submitted it wholeheartedly to us. If we are doing your procedure, we try our best to save you and you die. You sign the consent form. It will cover us. We tried our best. It's now up to us as a medical practitioner to know that the fault is not coming from the anesthesiologist. It's not coming from us. It has nothing to do with any procedure or the drugs that or negligence. So, but then, we also need to understand that doctors are meant to save life. When things go beyond you on the table, we have different specialties in the tertiary healthcare system, whereby as we tell you, maybe we're seeing ovarian something cyst, and we discover that, oh, you are having perforation of the intestine or something, we'll run, we'll call the general surgery unit, or we call the gastro. They have their own surgeon, they will come and they will do it. So you can't be jack of all trade, and that's why we have specialties. So at the end of the day, if they now discover that, okay, you're doing surgery, you went and touched another place, patient can prosecute you as well.
I think this is a way forward for collaboration. I think this is a benefit that worked out after the pandemic that happened, was when there was travel restrictions. This is what changed. Hospitals started sending senior consultant to different destinations, started doing outpatients, and as you rightly said, even solid organ transplant facilities being set up in different places. This kind of an innovation has happened. And I think knowledge sharing in terms of both the countries makes a very big critical factor in terms of, as you rightly gave some examples of doctors coming from there to India, in terms of getting critical training and then becoming heads of departments in their own country. Because that is a value addition in terms of both consultants for nurses and paramedics. That kind of a collaboration would work very well. So with this thought in mind, that as we are progressing in this discussion, I would like to go to Miss Susan, if it is okay, to discuss about, the worldwide, the countries right now are realizing the value of
A consensus reached by speakers at the event borders on the need for government, healthcare professionals, private sector entities, and international organizations in both sectors to collaborate in realizing this vision, one that will indeed go a long way in positioning Nigeria as a hub for medical tourism in Africa.